Hello everyone, and welcome to our educational video about Indigenous Australians living in rural and remote regions. As you are probably aware, the health status of Indigenous Australians who live in remote and rural areas is worse than that of non-Aboriginal people. We only have to look at the gap in life expectancy to find evidence of this. There is a myriad of reasons for these differences, such as a lack of access to appropriate services for Aboriginal people living in rural and remote areas. A lack of access can be detrimental to Indigenous health, as it can have lasting effects throughout a person's life. Reasons for the poor health status of Indigenous Australians has partly to do with their background and history. The treatment of Aboriginal Australians by British colonists was sickening. For example, Aboriginal people could not vote until 1962. The treatment of Aboriginal people by governments and organisations has jaded their view of the health system, with many people not trusting the system, as it is closely associated with the government, and many people refer to the stolen generation as a reason for their mistrust of the government and like organisations. Aboriginal people in rural and remote areas felt that there was an agenda pushed onto them by non-Indigenous Australians to assimilate to a different kind of health, one that did not align with their cultural beliefs. Thus, they were less likely to use the services, which caused them to lose faith in the system even more. Another example of how history can affect the health of the population is through transgenerational trauma. Many Aboriginal people are still feeling the effects of the trauma felt by their older relatives, and it is having adverse effects on their mental health, and in turn affecting other aspects of health, such as their ability to access healthcare. There are also many risk factors that can contribute to the health status of Aboriginal Australians. I will discuss these now. Body composition. In the past, Aboriginal Australians were hunter-gatherers and collected their food off the land around them. Their diets changed depending on what time of year it was and where they were. They ate foods high in protein, carbohydrates, and low in sugar. Although not much is known about their lifestyle before colonisation, there is evidence to suggest that they lived strong, fit, and healthy lives. After the Europeans arrived, Aboriginals were forced to consume a more Western diet, which has affected their health dramatically. The average birth weight of Indigenous babies is much lower than non-Indigenous babies. Shockingly, more than 1/4 of the low birth weights were due to inadequate nutrition of the mothers. Starting off life underweight can cause problems with normal growth patterns and potentially impact their development. If the mothers don't receive an adequate food while they are pregnant, then it is likely that the child will not receive enough food once they are born. This lack of food leads to malnutrition and long-term health effects for the child. The rural and remote location of where they live can limit their food supply due to accessibility and difficulties in transportation. Housing. Unfortunately, Indigenous Australians don't receive the same housing and infrastructure that most other Australians receive. There are typically too many people residing in the dwelling for the size of the house. This overcrowding can impact the child physically and mentally, as they cannot live comfortably. Remote communities suffer the most, as they can be so far away from mainstream shops that it can be hard for them to source the equipment and tools required to build an appropriate house. They might also not have the finances to buy suitable equipment. Nutrition. Poor nutrition is also a commonly experienced risk factor amongst Indigenous Australians. The 2004-2005 National Torres Strait Islander Survey showed that only 19% of Indigenous Australians were consuming the recommended amount of vegetables per day, and only 15% consuming the recommended amount of fruit. Indigenous Australians living in remote and rural areas experience limitations in accessing adequate food supply due to factors such as transport, distance, and cost. The limitation ends up being a risk factor to their health, as poor nutrition is commonly linked with obesity, malnutrition, cardiovascular disease, type 2 diabetes, and certain cancers. Low fruit and vegetable intake makes up for 5% of the health inequality between Indigenous and non-Indigenous Australians. Tobacco use. The 2008 National Aboriginal and Torres Strait Islander Social Survey found that 44% of Indigenous Australians over the age of 15 were regular tobacco users. The rate of tobacco use increased to 52% in rural and remote areas. Over half of the Indigenous mothers who were surveyed smoked during pregnancy. Smoking accounts for up to 17% of the health gap for Indigenous Australians. Tobacco use is a huge risk factor for many chronic diseases, such as cardiovascular diseases, certain cancers, and lung diseases, and it can dramatically impact the health status of Aboriginal Australians. Education. Living in a rural or remote area can sometimes mean that there isn't a school for the children to attend. Adults in the village may be uneducated, and thus children are severely disadvantaged compared with other children who live in metropolitan areas. They may be able to learn their traditional medicines and ways of healing. However, they may be unaware of many of the potential hazards that could contribute to their poor health. Childhood experiences. Due to transgenerational trauma, many children are brought up learning about the sufferings from the past, and thus they are more likely to suffer psychologically compared to non-Indigenous Australians. Unfortunately, many children are still being forcibly removed from their families. This could impact them not only on their family, but also the health of the children around them. Physical activity. Another risk factor in the 2012-2013 Australian Aboriginal and Torres Strait Islander Health Survey was physical activity. The survey found that less than half of the Aboriginal and Torres Strait Islander people interviewed, who are over the age of 18, met their daily recommendations of physical activity. Aboriginal Australians are more likely to live a sedentary lifestyle compared to their non-Indigenous counterparts. Individuals living a sedentary lifestyle are more likely to have negative health outcomes and have a much greater chance of developing obesity. Physical inactivity accounts for 12% of the health gap between Indigenous and non-Indigenous Australians. Of all Australians, Aboriginal and Indigenous Australians experience the lowest socio-economic status. The average income for Indigenous individuals is significantly lower than non-Indigenous Australians, and their unemployment rate is more than twice as high. Socioeconomic status has a huge impact on the health outcomes of Indigenous people. Low financial ability means affording costs associated with health become difficult. For Indigenous individuals in rural and remote areas, these costs are often greater as there is also distance and travel to these services that needs to be taken into consideration. Socioeconomic variables can explain for 30 to 50% of the health differences between Indigenous and non-Indigenous people. Although the access to healthcare services has somewhat been improved for Indigenous Australians over the last decade, there are still barriers to accessing these services, which impacts their health outcomes. These will now be discussed. Rural location and isolation from urban locations. Indigenous Australians are more likely to live in rural and remote locations rather than non-Aboriginal people. This means they may have less access to facilities such as shopping centres, schools, leisure centres, and the main one, health services. Health services and professionals tend to be less common in rural and remote areas than urban areas, which creates limitations in seeking healthcare in the community. Lack of transport is another barrier that can affect those living in both remote and rural areas. In a study conducted that reported on why people do not access healthcare, people in rural and remote areas listed transport and distance as some of the main reasons they did not access healthcare. Socioeconomic status. The socioeconomic status of Indigenous Australians is another barrier to accessing health services. Socioeconomic status consists of a person's education, occupation, and income. Lack of education can hinder a person's understanding of health issues they may be experiencing. Those living in remote areas may not have access to education facilities, which again may affect one's ability to access health services. For example, someone living in a remote area may not know the dangers of drinking unfiltered water and may seriously harm their health, and they would not even know why. A higher level of education improves overall health status, but access to schools is an issue in itself for those living in rural and remote areas. If one doesn't have an education, then they are also unlikely to get a good occupation and income. The lack of occupation and income in a family prevents them from accessing health services, as they cannot afford to see a doctor or other health professionals, as well as the cost of treatment and medication. Availability and affordability of services. Availability and affordability of services is another factor that causes a barrier to accessing health services for Indigenous people living in rural and remote areas. As the number of medical practitioners per head of population decreases, with increasing geographic remoteness, it can be increasingly difficult to access appropriate services. In this case, people would have to move or travel a long distance in order to gain access to medical care. Affordability also links with the availability of services. There are some services that require patients to pay out of their own pocket, such as dentists, psychologists, and physiotherapists, as they are not covered by Medicare. This mainly affects Indigenous people living in rural and remote areas, as they may usually be in the poorer economic position. Cultural barriers. A lack of understanding of Indigenous culture and poor perceptions or lack of respect towards them by non-Indigenous health practitioners can create problems. Cultural awareness should be a priority for health practitioners, and understanding Indigenous culture and the needs of Indigenous patients. Indigenous cultures have kinship rules that are required to follow. There are certain kin relationships to avoid and/or rules regarding contact. In relation to healthcare settings, one of the reasons why some women don't access health services is because a male has to transport the woman to get access. When female staff treat Indigenous male clients or vice versa, it can cause discomfort and shame, specifically when dealing with sexual health matters. It is important to provide Aboriginal health services, especially in more remote areas, as this would be more suitable and have clients feeling more comfortable to access these services. Continuing on from cultural barriers, we see that racism is also one of the factors that cause a barrier to accessing health care among Indigenous people. The impact of racism on Indigenous people has made them feel unequal to accessing the resources required for health. An example of this treatment could be that Indigenous patients were about 1/3 less likely to receive suitable medical care across all conditions compared to non-Indigenous Australians with the same medical needs. Community engagement. General health services that are accessed by the general population are not adequately meeting the particular needs of Aboriginal people. Numerous researchers indicate that for health services to reach Indigenous Australians in appropriate ways, need to deliver positive messages. If these health services are delivered with a positive approach and understanding of Aboriginal culture and lifestyle, a positive outcome may be documented. Programs such as Aboriginal community-controlled health services make this realistic by allowing these communities to empower themselves by giving them the opportunity to deliver holistic, comprehensive and culturally appropriate healthcare through a locally elected board of management. While there is a raft of barriers to healthcare for Indigenous Australians in rural and remote areas, there are things that health practitioners can do to make the environment more suitable and appealing for these. These are called facilitators. Relationships. Often what makes us visit the same doctor more than once may not be the attention to the ailment that we have, but the overall care and safety we feel. It is vital that for those who are in the healthcare sector to build a rapport with their clients, as it may determine their attitude towards health in general. A study conducted by Brady et al. Reported that Indigenous people claim that their relationship with healthcare staff was just as, if not slightly more important than the location or quality of medical care they received. This can be due to the fact that when healthcare workers build strong relationships with their clients, the clients feel like their opinions are respected and welcomed and are listened to. Presence of Indigenous staff. By hiring and providing Aboriginal people in the community with jobs in healthcare, they can become important assets for reaching Indigenous communities. The availability of Indigenous staff is an important factor in whether or not Indigenous people are able to effectively access health services. By seeing familiar faces, one can feel comfortable and understood. Indigenous healthcare staff are able to spread information and raise awareness, as they have the skills and knowledge to do so. The presence of Indigenous staff can also be vital, as they can educate non-Indigenous staff on what is culturally appropriate, as well as advocate on behalf of their communities in terms of health promotion and funding. The presence of Indigenous staff can also empower Indigenous communities, especially youth, as it sheds stereotypes and promotes diversity. Access to important healthcare services. Making important health clinics available to those in rural areas may contribute to lower morbidity and mortality rates. By providing clinics, such as family planning clinics, knowledge on reproductive and sexual health would be readily available to those in need. Services provided by these clinics is such as sexual and reproductive education, testing for diseases like HIV, medical abortions, contraception distribution, and disability counselling. These services are crucial for young individuals who are either already in a romantic relationship or are ready for one, as it breaks down the stigma associated with the subject. That is all we have got time for. Thank you for listening, and we hope that you enjoyed.